Can the food you eat every day quietly decide the future of your prostate? Most men never think about it until the symptoms start. Frequent bathroom trips, a weak urine stream, waking up 2 or 3 times a night, and that constant worry in the back of your mind. Is this getting worse? But what if I told you that many of the foods sitting in your kitchen right now are actively feeding prostate growth, inflammation, and hormone imbalance? And even more importantly, that by removing just 9 specific dietary triggers, many men are seeing real improvements in symptoms. And in some cases, measurable changes in prostate markers. Today, I'm going to show you the 9 foods that silently damage prostate health and the biological reasons why they do it. This is not about fear. This is about taking control and giving your body the environment it needs to calm inflammation instead of fueling it. Because prostate problems do not start overnight, they build slowly, meal by meal, through inflammation and hormonal disruption. And that's where we begin. Why the prostate starts to grow. In simple terms, to understand why food matters so much, you first need to understand what actually drives prostate problems. There are 2 major forces behind prostate enlargement and disease. First, chronic inflammation. Second, hormonal imbalance. Let's start with inflammation. Inflammation is supposed to help you heal. But when it becomes chronic and low-grade, it turns into a constant growth signal. Inside the prostate, inflammation increases chemical messengers called cytokines. These signals tell prostate cells to divide, multiply, and expand. Over time, this leads to tissue swelling, gland enlargement, pressure on the bladder and urethra, and worsening urinary symptoms. But inflammation does more than irritate tissue. It also damages DNA, increasing the risk of abnormal cell changes over time. Now let's talk about hormones. The hormonal shift that happens after 50. The prostate is highly sensitive to male hormones, especially a hormone called DHT, which is made from testosterone. DHT directly stimulates prostate cell growth. But as men age, something else happens at the same time. Testosterone slowly declines. Body fat often increases, and an enzyme called aromatase becomes more active. This enzyme converts testosterone into estrogen, so now you have less protective testosterone, more growth-promoting estrogen, and DHT still stimulating the gland. This hormonal shift creates the perfect internal environment for prostate enlargement, and certain foods make this imbalance much worse. Some raise insulin and IGF-1, powerful growth hormones. Others increase estrogen activity. Others drive more inflammation. So now let's look at the foods that create this dangerous internal environment. Food category number 9, red meat and processed meats. Let's start with a big one. Red meat, especially processed meats like bacon, sausages, hot dogs, deli meats. These foods increase prostate risk in several ways. First, cooking meat at high temperatures creates toxic compounds that damage DNA. Second, processed meats contain nitrates that convert into cancer-promoting chemicals in the body. Third, red meat is high in saturated fat, which fuels chronic inflammation. And fourth, the heme iron in red meat increases oxidative stress, further damaging prostate tissue. Large population studies consistently show that men who eat the most red and processed meats have higher rates of prostate enlargement and more aggressive prostate disease. Better options include fish, poultry, plant-based proteins, beans, and lentils. Your prostate does not need daily red meat to stay strong. Food category 8. Sugar and high glycemic foods. This may be the most dangerous category of all. Sugar, sweet drinks, pastries, white bread, and many breakfast cereals cause sharp spikes in blood sugar. This forces your body to release large amounts of insulin. And insulin is not just a blood sugar hormone. It is also a powerful growth hormone. High insulin increases levels of IGF-1, which directly tells cells to grow and divide. Prostate cells respond very strongly to IGF-1. So, high sugar diets literally send growth signals to your prostate every single day. Over time, this accelerates prostate enlargement, hormonal disruption, cancer-promoting pathways. And this effect is even stronger in men with belly fat, prediabetes, or type 2 diabetes. Reducing sugar is one of the fastest ways to reduce growth pressure on the prostate. Food category the for 7, refined grains, white bread, white pasta, white rice, commercial baked goods. They may not taste sweet, but your body treats them just like sugar. They digest quickly, spike insulin, and activate the same IGF-1 growth pathways. But there's another problem most men don't realize. When fiber is removed, the body loses one of its main tools for removing excess hormones through digestion. So, refined grains increase growth hormones, reduce hormone elimination, increase inflammation. Whole grains behave very differently. Oats, barley, quinoa, and brown rice digest slowly, stabilize blood sugar, and support hormone balance. For prostate health, grain quality matters more than most people realize. Food category for 6, excessive dairy, especially whole milk. This one surprises many men. Milk is designed to make a baby calf grow very fast, so it naturally contains growth factors, including IGF-1. Studies repeatedly show that high milk intake is linked to higher prostate risk. There are 2 main reasons. First, high calcium intake from dairy may lower active vitamin D levels, which normally help regulate cell growth. Second, dairy directly increases circulating IGF-1, which stimulates prostate tissue growth. High-fat dairy concentrates these effects even more. Better options include fermented dairy like yogurt, plant-based milk alternatives, smaller portions instead of daily large servings. This is not about never eating dairy. It's about not turning it into a daily hormonal trigger. Food category for 5, industrial seed oils and trans fats. Now we come to one of the biggest hidden drivers of inflammation in modern diets: industrial seed oils and trans fats. These include oils commonly listed as soybean oil, corn oil, cottonseed oil, safflower oil, and generic vegetable oil. They are used in high-fried foods, packaged snacks, fast food, frozen meals. These oils are extremely high in omega-6 fatty acids and very low in omega-3s. Your body needs both, but the balance matters. When omega-6 intake is too high, your body produces more inflammatory compounds that irritate tissues, including prostate tissue. These inflammatory signals increase swelling, worsen urinary symptoms, and create an internal environment that encourages abnormal cell activity. Trans fats are even more damaging. They interfere with normal cell membranes, increase oxidative stress, and intensify inflammatory responses throughout the body. For prostate health, this constant inflammatory signaling is one of the strongest drivers of symptom progression. Better fat choices include olive oil, avocado oil, nuts and seeds, fatty fish. Simply changing cooking oils can significantly reduce your daily inflammatory load. Food category for 4, excessive alcohol. Moderate alcohol may not be a major problem for many men, but regular or heavy drinking creates several prostate-unfriendly changes inside the body. First, alcohol stresses the liver, and the liver is responsible for clearing excess hormones, especially estrogen. When the liver is overloaded, estrogen stays in circulation longer. Higher estrogen relative to testosterone promotes prostate tissue growth. Second, alcohol increases aromatase activity, especially in abdominal fat. This means more testosterone is converted into estrogen. Third, alcohol increases oxidative stress and inflammatory markers throughout the body, so alcohol contributes to prostate problems through both hormone disruption and inflammation. Limiting alcohol, especially frequent daily drinking, supports healthier hormone balance and reduces unnecessary inflammatory burden. Food category 3, charred and overcooked meats. This category is not about the meat itself, it's about how it's cooked. When meat is cooked at very high temperatures, especially when it becomes blackened or heavily browned, harmful compounds are formed. These compounds can damage DNA and increase cellular stress. Over time, repeated exposure may increase abnormal cellular changes in sensitive tissues, including the prostate. This doesn't mean you must avoid cooking meat. It means choosing gentler cooking methods. Better options include baking, stewing, slow cooking, light sautéing. If you grill, avoid blackened surfaces and consider using herbs like rosemary and thyme, which can reduce formation of harmful compounds. Small changes in cooking style can reduce long-term risk without giving up favorite foods. Food category number 2, excessive caffeine. Caffeine is not directly linked to prostate growth, but it strongly affects urinary symptoms. Caffeine increases urine production and irritates the bladder and urinary tract. For men already dealing with prostate enlargement, this can mean more urgency, more frequent trips to the bathroom, more nighttime awakenings. Caffeine also stimulates the nervous system, which can increase bladder muscle sensitivity. So even small amounts of urine can trigger strong urges. Many men notice that reducing caffeine improves comfort and sleep quality within days. Better options include green tea, herbal teas, half-caffeine coffee, caffeine-free alternatives. Improving sleep alone can significantly improve quality of life for men with prostate symptoms. Food. Category number 1, high-sodium processed foods. This is the final and one of the most overlooked dietary triggers. Highly processed foods are loaded with sodium. Canned soups, frozen meals, snack foods, fast food all contribute large amounts of salt. High sodium increases fluid retention and thirst. This leads to higher fluid intake and more nighttime urination. But there is more happening inside the body. High sodium intake is linked to increased inflammation and activation of hormone systems that regulate fluid balance and blood pressure. These same systems influence tissue remodeling and gland enlargement. So excessive salt doesn't just increase bathroom trips. It may also contribute to prostate tissue changes over time. Reducing processed food automatically lowers sodium intake and improves overall metabolic health at the same time. So let's bring this all together in a simple, clear way. Prostate health is not determined by one single food. It is shaped by patterns you repeat every day. And the strongest patterns that push the prostate in the wrong direction come from these 9 categories. Red and processed meats that increase inflammation and oxidative stress, sugar and high glycemic foods that spike insulin and IGF-1 growth signals, refined grains that behave like sugar and disrupt hormone clearance, excessive dairy, especially whole milk, that increases growth factors, industrial seed oils and trans fats that fuel chronic inflammation, excessive alcohol that shifts hormone balance toward higher estrogen, charred and overcooked meats that introduce cellular stress, excess caffeine that worsens urinary urgency and nighttime discomfort, high-sodium processed foods that increase fluid retention and inflammation. When these foods dominate your diet, the body stays in a constant state of irritation and hormonal confusion. And the prostate responds by growing, swelling, and pressing on the urinary system. But here's the encouraging part. When you remove the constant triggers, the body does not need to keep sending growth and inflammation signals. Cellular repair becomes more efficient. Hormone balance gradually improves. And many men begin to notice changes in comfort, sleep quality, and daily functioning. This is not about chasing perfection. It is about reducing the strongest biological pressures acting on your prostate. Even replacing just a few of these food categories can begin shifting your internal environment in a healthier direction. Choose fish more often than processed meats. Swap sugary breakfast for fiber-rich options. Use olive oil instead of industrial oils. Reduce evening caffeine to protect sleep. Cook meats gently instead of charring them. These are not extreme changes. They are practical, sustainable adjustments that support your body instead of fighting it. And the benefits extend far beyond the prostate. Better blood sugar control, less systemic inflammation, improved cardiovascular health, more stable energy during the day. Everything in the body is connected. Now, I want to be very clear about something. Food does not replace medical care, and it is always important to follow guidance from your healthcare provider. But food absolutely influences the internal signals that drive tissue behavior. Every meal is information. And the more consistently you send calming, stabilizing signals to your body, the more opportunity your systems have to move toward balance instead of progression. Many men believe that prostate changes are simply an unavoidable part of aging. But aging does not automatically mean constant irritation and hormonal chaos. Aging bodies still respond to better conditions. They may respond more slowly, but they do respond. And that means you still have influence over your long-term comfort and quality of life. So instead of focusing on what you must give up, think about what you are gaining. More restful sleep, fewer urgent bathroom trips, less daily discomfort, more confidence in your health choices. This is not about restriction. It is about creating an environment where your body does not need to stay in survival mode. If this information was helpful to you, I encourage you to stay connected with this channel. We focus on simple, realistic lifestyle strategies that support healthy aging without extremes or complicated routines. And I'd like to ask you something. Which food swap do you feel ready to make first? Is it reducing processed foods, cutting back on sugar, changing cooking oils, or limiting evening caffeine? Share it in the comments. Sometimes saying it out loud is the first step toward real change. Thank you for spending this time with me today. Remember, your body is always responding to the signals you give it, and even small changes repeated consistently can create powerful long-term results. Take care of yourself, and I'll see you in the next video.